All right, let's dive right in, shall we? Today we're tackling a big one: youth unemployment in South Africa.
Yeah, it's a persistent problem, isn't it?
Absolutely. We've all seen those stats. Over 60%, sometimes even higher for young people aged 15 to 24. Tough, really tough.
It is. But what if, and this is where things get interesting, what if the solution is hidden in plain sight?
Okay, you've got my attention. Lay it on me.
What if the healthcare system itself could be the key to unlocking job creation for these young people? We've got some fascinating sources that suggest just that.
Healthcare as an engine for job creation. I'm listening.
So our sources point to 5 key areas, 5 areas where healthcare could really drive job growth.
5. Okay, let's start with number 1. What's the first area that's got you so fired up?
Community healthcare workers. Think about it, young people, trained, equipped to provide basic care, health education,
Right.
even helping out with telemedicine.
Reaching those communities, especially in rural areas where access is limited.
Exactly. We're not talking about replacing doctors or nurses. It's about extending their reach, amplifying their impact.
Yeah, that makes a lot of sense, especially in those remote areas. But logistically speaking, training and deploying a whole workforce, that's a massive undertaking, isn't it?
You're not wrong. It's not just about, basic training. You need ongoing supervision. You've got to ensure quality of care and then figure out how to seamlessly integrate them into the existing system.
Right. A lot of moving parts.
And of course, funding and infrastructure. You can't forget those.
So public-private partnerships, right. That's got to be a crucial piece of the puzzle here.
Absolutely. Businesses investing in training, maybe even, offering mentorship, job placement.
Giving them a real shot, a leg up.
Think about the mining industry, for example. They're already in many rural areas.
Yeah.
They have a vested interest in the health of their workforce, the surrounding communities.
So they could partner with the government, with NGOs.
Exactly. To create these sustainable training programs.
That's a win-win.
Win-win for everyone involved.
And speaking of innovation, our sources also highlight tech, the incredible potential of technology, to transform South Africa's healthcare system, create a whole new wave of jobs.
Oh, absolutely. That's our second key area, health technology and innovation.
Okay, let's unpack that a bit.
So telemedicine, for example.
Yeah.
Imagine doctors in cities consulting with patients in these remote villages.
Bridging the gap.
Or AI-powered diagnostics.
Helping healthcare workers in those underserved areas.
Make faster diagnoses, more accurate too.
These are amazing advancements, but do young people in South Africa have the skills to actually fill these roles? I mean, it's a whole new world, isn't it?
That's where targeted training programs come in. We're seeing a real surge in those. Coding boot camps, specifically designed for healthcare. Online courses, data analysis for medical research.
Wow.
Even partnerships with tech companies,
Okay.
providing on-the-job training, cybersecurity, cloud computing.
It's almost like we're not just talking about treating patients today, but actually building the entire healthcare workforce of tomorrow.
That's a great way to put it.
Are there any concrete examples? Are any of these technologies actually being implemented in South Africa right now?
Oh, there's some really, really inspiring examples. There's this one company, they developed this portable ultrasound device. It's low cost, can be used in remote areas, monitoring pregnancies, in areas where they don't have access to those big traditional machines.
Wow.
They're even using AI to analyze the ultrasound images to detect complications early.
That's incredible.
It is.
It sounds like these innovations are addressing the specific needs, the challenges right there on the ground in South Africa. Makes you wonder, how many more solutions are out there just waiting to be discovered?
It really does. And that actually brings us to our third key area.
Okay.
Entrepreneurship. Entrepreneurship in healthcare.
We're seeing young people in South Africa stepping up, creating their own solutions, right?
Driven by what they see around them, by a real passion to make a difference.
So not just filling existing jobs, but creating entirely new ones based on what their communities actually need.
You got it.
Okay, I need an example. Tell me about one of these healthcare startups that's really caught your eye.
There's this one, they developed a mental health app. But here's the thing. It's specifically designed for South Africa.
Yeah.
It uses AI to connect users with therapists, support groups.
Okay.
But it takes into account, language, culture, affordability. They've even got features that address the stigma.
Which is huge.
A huge barrier
Yeah.
to seeking help.
That's brilliant.
It is.
It's like they took a challenge, a serious challenge, and turned it into an opportunity to not just create jobs, but to make a real impact on people's lives.
Exactly. And what's interesting is that they're filling a gap. a gap that maybe more established institutions they just didn't see.
They're more nimble, more in tune with the needs on the ground.
They bring that fresh perspective, that willingness to take risks.
It's great to see that entrepreneurial spirit taking root in the healthcare sector, but let's be real. Not everyone is cut out to be an entrepreneur, right?
Sure.
What about young people who are looking for, a more traditional career path?
There are definitely opportunities for them too. And that's where our fourth key area comes in, allied health professions.
Okay.
So we're talking lab technicians, physiotherapists, radiographers.
Essential roles.
Absolutely. And the training, it's often shorter than becoming a doctor or a nurse.
So a quicker path to employment.
Exactly, which is really important when you consider, the urgency of youth unemployment.
But are there enough jobs in those fields? I mean, to make a real difference?
That's where strategic planning comes in, and collaboration. Analyze the workforce needs, identify the shortages, and then create these targeted training programs. Technical colleges, universities, even hospitals can get involved.
Working together.
Exactly. Imagine a system where young people are graduating with the exact skills that are in high demand, ready to work.
All right, so we've got 4 key areas. What's the 5th piece of this puzzle?
This one might surprise you. It's the wellness economy.
The wellness economy.
Globally, there's this shift happening towards preventive healthcare, a real focus on well-being.
Okay.
This opens up a whole new world of opportunities.
So not just treating illness, but promoting health and well-being.
Exactly. It's a proactive approach.
I like that. What kind of jobs are we talking about here?
Think fitness trainers,
Yes.
nutritionists, mental health coaches, yoga instructors, even, wellness entrepreneurs creating innovative products, services.
Wow, it's like a whole new sector is emerging.
It really is.
But how do we make sure these jobs are accessible? Especially, for young people who might not have the resources for traditional healthcare training.
That's where government policies come in. And community initiatives, subsidized training programs, grants for young entrepreneurs, public awareness campaigns, promoting the benefits of healthy living.
Showcasing the diverse career paths that are out there.
Exactly. It really is exciting, isn't it?
It is. It's like we're shifting the whole paradigm from reactive healthcare to, like you said, a proactive approach. But how do we actually make all of this happen? Our sources mention like public-private partnerships, government incentives, working with global organizations. Where do we even begin?
You're right. It can feel overwhelming. Where do you even start?
Yeah.
But our sources, they offer some concrete steps, Let's go back to those public-private partnerships. We talked about businesses investing in those training programs for community healthcare workers.
Right.
But it's bigger than that, Think infrastructure development, tech transfer, even mentorship programs, connecting those experienced professionals with young people just starting out.
That mentorship piece, that's interesting. Imagine like a young wellness entrepreneur having someone to guide them, someone who's already been there, done that.
Exactly. It's all about using the expertise, the resources that already exist in the private sector to help this new healthcare workforce grow.
Okay, so public-private partnerships are key. What about the government? What role do they play? Our sources talk about incentives.
Yeah, and that's where targeted policies can really make a difference. Think tax breaks for companies that hire young people in healthcare. Subsidies for those training programs, the ones that focus on data analysis, telehealth tech. Those high-demand skills.
That sounds good in theory, but wouldn't that require a huge investment from the government? I mean, South Africa is already facing, some tight budget constraints.
Yeah, that's a valid concern.
And how do we ensure that those incentives actually reach the people who need them most?
You've got some really important points there. That's why planning and implementation are so crucial. We need to make sure these programs, they're designed to maximize impact, minimize waste, transparency, accountability. Those are key.
Right.
And community involvement. They need to be a part of the decision-making process.
So it's not just about throwing money at the problem, right? It's about creating a system that's, efficient, equitable, a system that actually works for the people it's supposed to serve.
You got it. And that's where collaborations with global organizations come in. Imagine, tapping into the expertise of the WHO or UNICEF. Those groups that have experience with healthcare workforce development.
They've seen what works, what doesn't. They can bring those lessons learned to South Africa.
Exactly. We don't have to reinvent the wheel here.
Yeah.
They've got the knowledge, the resources, and don't forget about international funding. That could be a huge help in supporting these initiatives.
Right. We're not just talking about knowledge sharing. We're talking about potentially accessing additional resources to make this all happen. But even with all the right policies, all the partnerships, none of this will work if young people aren't excited about these opportunities, right?
That's such a critical point.
Yeah.
Our sources, they emphasize inspiration, awareness. We need to show these young people what's out there. The different career paths in healthcare, highlight the success stories, change the perception of what a healthcare job even means.
Show them it's not just about being a doctor or a nurse. It's about being a problem solver, an innovator, a leader, making a difference in your community.
Exactly. And we need to give them the tools to pursue those paths, starting with education. We need to ensure that STEM education, science, technology, engineering, math, that it's accessible to all students, no matter their background, no matter their socioeconomic status.
And it's not just about university, right? What about those vocational training programs, the ones that give young people practical skills, the kind of skills that healthcare employers actually need?
You need a multi-pronged approach. Give young people choices, whether that's a 4-year degree, a 2-year diploma, even an apprenticeship.
Options, a flexibility.
Exactly. A system that meets the diverse needs and aspirations of these young people.
Okay, so we've got partnerships, policies, education. It's starting to feel like a real plan is coming together. But as with any big plan, there are going to be challenges, right? What are some of the potential roadblocks we need to be thinking about?
Well, one of the biggest is inequality. South Africa has a history of systemic racism, economic disparities. And that's reflected in their healthcare system. We need to make sure that everyone, every young person, has access to these opportunities, no matter their race, their background, where they live.
Equal access. It's not enough to just create jobs. We need to make sure that the benefits are shared by everyone. What else?
Another challenge is ensuring the quality of those training programs. We need to make sure they're rigorous, relevant, that they're really giving young people the skills they need to succeed, because the healthcare landscape, it's constantly changing.
Right. We don't want a situation where we've got all these young people with qualifications, but those qualifications aren't actually leading to jobs.
Exactly. That's why it's so important to involve employers. Get them involved in designing the training programs and implementing them. Make sure what's being taught in the classroom, it matches what's needed in the real world.
Bridge that gap between education and employment. Make sure that young people are graduating with skills that employers actually want.
Yes, and foster that culture of continuous learning. Healthcare is always evolving. New tech, new treatments. Young people need to be able to adapt, learn new things, stay ahead of the curve.
So it's not just a one-time training program. It's about lifelong learning, professional development. That makes sense. Now let's shift gears a bit. I want to talk directly to our listener. Imagine you're a young person in South Africa listening to this conversation, maybe feeling hopeful, maybe a bit skeptical. What would you say to them? What message would you want them to take away from all of this?
I would say this: don't underestimate your own power. You can be part of something truly transformative. The challenges are real, but we can overcome them. With the right vision, collaboration, determination, we can create a future where healthcare is more than just treating illness. It can be a catalyst for economic empowerment, social progress, a brighter future for everyone.
I love that. It's about reclaiming agency, right? Seeing yourself as part of the solution, not just a bystander, and believing that change is possible, even when the problems seem really, really big.
It's about choosing to believe in a better future and then working together to make it happen.
And that brings us to a really interesting question. Our sources, they talk about the potential for unexpected positive ripple effects. If this vision, healthcare driving job creation, if it actually takes hold in South Africa,
it makes you think beyond just solving those immediate problems. What happens next? What are the long-term implications?
Okay, I'm hooked. What are some of those unexpected consequences?
Well, for one, we might see a shift in social norms, attitudes towards health, well-being. Imagine a generation of young people growing up with access to good quality healthcare, who understand healthy lifestyles, and who see themselves as active participants in their own well-being.
Wow, that's powerful. It's not just about individual health. It's about a whole cultural shift, a more health-conscious society.
Exactly. And that shift, it could lead to a reduction in chronic diseases, longer lifespans, a more productive workforce.
Okay, those are some pretty big ripple effects.
And there's more. We might also see a surge in innovation, entrepreneurship, not just in healthcare, but across the board.
Really? How so?
Well, think about it. A whole generation of young people who've been empowered by their experience in the healthcare sector. They've developed problem-solving skills. They've learned to navigate complex systems. They're not afraid to take risks.
So they take those skills, that mindset, and apply it to other areas.
Exactly. Education, agriculture, technology, you name it. We can see a wave of new businesses, social enterprises, driven by a passion to make a difference.
It's like a domino effect, isn't it? One positive change leads to another and another and another.
Exactly. It's a powerful idea, one that's definitely worth thinking about.
We've covered a lot of ground today, but as always, there's more to uncover. We'll be right back to wrap things up and leave you with one final thought-provoking question to ponder. And we're back, wrapping up our deep dive into healthcare as a potential solution for youth unemployment in South Africa. We've explored those 5 key areas, talked strategy, even considered some roadblocks. But we left off on those, what were they? Unexpected positive ripple effects.
The kind of things that happen when you go beyond just solving the immediate problem, those long-term, broader implications.
Oh yeah, you got me hooked on those. What else could we see happening if healthcare really becomes this engine for change?
Well, we talked about cultural shifts, right? A more health-conscious society. But what about a renewed sense of national unity? Purpose. Imagine young people from all backgrounds working together towards a healthier, more prosperous South Africa.
It's like they're not just building careers, they're building a future together, a shared mission.
Exactly. And that sense of unity, it could bridge divides, break down those old stereotypes, foster a real spirit of collaboration that goes way beyond just the healthcare sector.
It's powerful stuff.
And think about South Africa's image on the world stage. If they become known for this innovative approach, their success in tackling youth unemployment, it could attract investment, boost tourism, maybe even become a model for other countries.
From struggling with a seemingly impossible problem to being a global leader, that's quite a story.
It really is. And here's the thing, it could create this positive feedback loop. The economy grows, their global standing improves. That creates even more resources to invest back into healthcare.
Fueling the cycle of positive change.
Exactly.
We started this deep dive asking, could healthcare be the solution to South Africa's youth unemployment crisis? And now it feels like we've stumbled onto something so much bigger, like a whole new blueprint for a healthier, more prosperous, more equitable society.
Isn't that what it's all about? Using what we know, our creativity, our resources, to create a world where everyone has the chance to thrive.
Well said. I'm walking away from this feeling inspired. It's a good reminder that even when things look tough, there's always hope, potential, and the possibility for unexpected change.
That's the beauty of exploration, isn't it? Asking those questions, challenging assumptions, embracing the idea that solutions can come from the most unexpected places. Who knows what other ripple effects are waiting to be discovered?
It's an exciting journey, and we're all part of it. And to our listeners out there, keep that journey going. Keep asking those questions. Keep exploring. And keep believing in the power of ideas to change the world. Thanks for joining us.